Hi, brown eyes.
You have a child and you have a million and one hopes for your baby.
You did great last night.
And when you get a diagnosis that your child has a life-limiting disease, some families will say, well, what do I have to hope for? You do have a lot to hope for. And I think one of the things that we try to do is really reframe what hope is for families. Of course, we hope for a cure, but when that's not possible, doesn't mean that there's no hope. It's just, it looks different.
Cock-a-doodle-doo, crowed the rooster. Want to catch a pesky fly? I was pretty much having a nervous breakdown because her care was getting more complicated. She was having trouble eating. And I think that the medical team, who is wonderful, I remember her, saying, I think you need some help. I think you need some help. And I remember thinking, I'm a terrible mother, I can't take care of my child.
Do you remember that day? The emotions that day?
I wasn't very happy to meet them. You're angry, and they're the messengers with this terrible news. And no matter how kind and how wonderful they are, you just want to scream to tell them to leave the room.
Yeah. It's scary for parents. We don't want to go in with an agenda. Really, our agenda is really to get to know the families because we know it's going to be a long journey. And so the only way we can get to learn how to support families is really to know what's important to them and what's not. Hospice's philosophy is really to maximize the quality of life.
Do you know this is the latest you've slept?
They are experts in symptom management to try to, what can we do at home to minimize symptoms and maximize the quality of life.
I try to get everything done in the morning when she's watching the programs that she loves so much. And I hear her laughing, or she giggles sometimes.
You did a great job. Very good this morning. Well done.
We made a turkey for Thanksgiving, didn't we? Out of your little hand. So sweet.
We're there as an extra layer of support. And how that looks like is really different from family to family. Our team consists of physicians and nurses and child life and social work, and we have a chaplain, and we have an art therapist. You get to know a family and you figure out what's really going to be helpful and what's not.
Hi, Peggy. How's she doing?
Oh, she's great.
Oh, good.
She had a very good night.
Hi, Cal. I come and make sure that Callie's comfortable, has all the supplies she needs, and the medicine she needs to keep her comfortable. Oh, how you doing, huh? Good job. You look so pretty today. What color did you got your nails today? Let's see. Oh, they're beautiful. We provide the babies and the children to be at home as long as they can and be comfortable.
Cal has her nurses, Karen's here, and she has Peg. If I get a phone call from Maria, I will say, is there a nurse in the house? Let me speak to one of the nurses. And is there something that we can do in the home, or do I have to say, no, we have to come back into the hospital? The hospice component of it and the home care component are our eyes and ears.
There have been times we call 24/7 and they know her. I remember one time we called and it was Gina and I said, Gina, I think there's blood in Cal's stool. And you said, Maria, it's a hemorrhoid. I was about to run into the hospital about a hemorrhoid. Yes, I know. What?
Yeah, I think those little changes may mean something. And then, we can see how she goes.
The first thing people say is, it's giving up.
She runs those little pockets of time where she does great, and then she has those little bumps in the road.
Their fear and maybe even anger about it is the sense that they think that palliative care and hospice is giving up, and it's not. It's about focusing on quality of care, focusing on the patient and getting the help you need. They were part of helping me figure out how to put our life back together again. And I think it's one of the reasons Cal's still alive. She's still smiling and laughing every day. This is a very different kind of battle. This is a very different kind of way of taking care of a kid, but we fight very hard. We fight really hard, but in a way that's focused on making Cal's life beautiful.
Oh, Pa, good job. So are you good on supplies? You need anything? Okay.
For families who are tentative about having palliative care, I would say just let them in the door and give them 5 minutes. And if it's not for you, and if it frightens you, it's okay, they understand. And if you need them, they will be back. Give them 5 minutes. Let them in the door and see how they can be helpful. You know, help is help.